Representatives of 6 of the 8 presidential candidates in this year's elections have given details of their party's health policies to be implemented if they assume power. Policies on mental health, sanitation, non-communicable diseases, malaria and other health-related issues were on the discussion table in the last edition of the Case of the Manifesto on GTV.
As the campaign season turns the corner to the elections, all the presidential candidates continue to give more details about their policies. On GBC's election program Case of the Manifesto, the CPP, GCPP, PPP, UFP, NDC and a representative of the only independent candidate, Joy 2012, have spelled out how they intend to properly run the health sector in the next 4 years. On sanitation, they all agreed that it was a major war which must be tackled extensively. Financing of the health sector in the face of pending cuts in support by donor agents was also extensively discussed.
We'll have to spread the net across board. It has to capture almost everybody so that there is enough money coming in, and then of course money is being managed prudently.
Joy 2012, the independent ticket, it said the party structure in Ghana is so bad. I personally cannot see why to run a small country like Ghana, the bureaucracy cannot be run by just 30 ministers. I cannot see why do we need 78 ministers, deputy, why?
In this country, we have the only infinite natural resource, which is salt. And all of a sudden, salt seems to have gone below the radar. Nobody talks about it. But investment into our health industry can generate significant amounts of money for this country.
What we are going to use to finance healthcare is to looking back into our energy sector. We talked a lot on solar energy. And I've always been drumming the fact that we shouldn't continue being passive consumers, but being a production country. If we are producing, then we can get the money to finance our healthcare.
PPP will enforce the rules and the regulations that already exist, ensure that people do the right thing so as to reduce our communicable diseases, save money there, and use it to finance those areas that are beyond or that we cannot immediately take care of it.
If we take monies serious, if we put our monies where our mouths are, we will make sure when we come to power, we will do the most important things first by making structures work, making people who are in that positions of, taking care of such facilities as was created by the last government work for Ghanaians.
Alternative sources of energy, solar, biogas and biomass were also covered by the representatives, as was the training of more doctors and nurses and the equitable distribution of health professionals, incentives and infrastructure.